Expectations vary from patient to patient, so we work very closely with the patients to make sure that those expectations are realistic for each individual. And the things that impact what our expectations should be would include the age that their hearing loss occurred, how long they've been without hearing. Has the hearing loss been progressive? Has it been profound all of their life? If they've continued to use hearing aids. And the reason that we look at those things is that the cochlea is where we're putting the implant, but the information from the implant actually travels up a nerve to our brain. And it's that nerve that's sending that information up that if it has not been used over a longer period of time, it's kind of like a muscle, use it or lose it. And so we have to train that information to be able to get to the brain and have that system working well. So the longer it's been, the longer the rehabilitation process tends to be.
The first thing that everyone has to realize is that the cochlear implant device, as wonderful as it is, it's trying to reproduce a truly complex organ of the body, the ear. And nothing's ever as good as Mother Nature is. And so, yes, people can hear clearly and hear fairly well, but it's not quite what you and I may be used to hearing in everyday situations. But some people liken it to learning a new language, if you may. What you hear from the cochlear implant does require some training and a great deal of work with our audiologists after surgery, after activation of the device, and we call that rehabilitation. And essentially, through working with our audiologists, you go through an extensive period of oral rehabilitation for, can be up to months, before the device user is able to fully take advantage or interpret everything they're hearing.
To continue to learn more about the Cochlear Implant Center at GBMC, please click the buttons on the screen.